Good afternoon. My name is Corinne Waldow. I'm the Economic Development Director of the Boulder Chamber. I want to welcome you to this week's retail office hour call with Boulder County Public Health. I want to thank all the other chambers out there for getting the information out to businesses, economic development agencies, cities, to try to get businesses as much information as they can about how to safely reopen, and to provide you these opportunities to ask questions, provide feedback, get updated information, and also just to really learn about the best practices for making it a safer environment for our economy and for our health. At this time, I'm going to hand it over to Zach Swank with Boulder County Public Health.
Thanks, Corinne, and thanks for the continued partnership with Boulder Chamber, as well as the partnership of our other chambers and economic vitality staff across the county. So today we've got our retail session, and we'll go over the usuals. Quick recap of Safer at Home for anyone who's new to these sessions. Ditto for face covering. The Angel will then cover the resources to support you, and we'll have plenty of time for Q&A. So just as a reminder, we are currently under Safer at Home since May 9th, as well as a face covering order. Boulder County Board of Health will be voting on extending the face covering order or not tonight. So look for an update for that coming soon. As well as we are all looking forward to the update from the governor, where he's expected to address spring skiing and outdoor recreation, restaurants, as well as summer camps. We may see other changes to the order as well. But long term, it's good to remember that we hope to see Safer at Home evolve with the governor's announcement, but we'll be under some version of this until we have vaccine, treatment, or herd immunity. And I saw recently that it's estimated that Colorado is at about 3% of Colorado has been infected with COVID-19, and it would take, by some estimates, 70% to be infected before we achieved herd immunity. So that is going to be quite some time, which I think underscores that you should steel yourselves to and prepare your business plans that it will be months likely that we are under some version of these restrictions. Which gets to the other point, COVID-19 is still just as contagious as it always was. Even as we begin to open our businesses and open our economy more and move around more, that doesn't mean that we're, the conditions that started this all off are any different now than they were before. We just have, better, finer tuned protocols in place than we did, with our regular lives in January. So it's important to continue to stay at home as much as possible. And practice physical distancing as much as possible and follow all of the orders, requirements, obviously, as well as the best practices. The thing that we want to avoid is backsliding and having to go back to a more restrictive order because we had an upspike in cases. Speaking of, this is a chart of the average of 5-day new cases. So averaged over 5 days for each day as shown on the chart. And you can see very clearly that we are going in the right direction. I looked at an updated version of this chart today, and the trend continues in the right direction. But one thing to note is that because of the lag time in incubation period of COVID, which can be up to 14 days, the number of new cases that appear on this chart today really reflect the infections that happened a week ago or even 2 weeks ago. So as we're looking at this data, today's data does not, reflect, who contracted COVID today. It's just, who tested positive. So that's an important thing to, and part of the delay and why these orders are changing so slowly is because we need the time between any change to the order to see the effect. And just as a reminder, Boulder County Public Health and these webinars are here to help you comply with the orders. which are frequently changing, and we're working to support you, but we cannot provide specific legal advice about your specific business. So if you have very specific questions, we do recommend that you contact an attorney. But a good place to start is following all of the orders. And with that, I will turn it over to my colleague, Angel Bond, who's our lead liaison for the retail sector.
Thank you, Zach, and thank you, Corinne from the Chamber. We really appreciate having this opportunity to talk to you today. So some of the common questions that we're receiving for retail are about cleaning and quarantining retail products. So we had talked about this last week a little bit more in depth, and there is some guidance on Boulder County Public Health website that I'll point out here in a minute. But basically the questions that we were getting was how to clean and quarantine clothing and soft goods. So we provide guidance on that in this guidance document, and what we're saying is 7 days of quarantine. So you can quarantine the items in maybe a separate fitting room, is what Corinne had mentioned last week, but just have those quarantined items set aside in separate piles. So if you quarantine an item for 7 days, you don't want to necessarily put a new item on top of that pile of items. You want them to be separated, not touching. They can still be in the same dressing room area, hanging up in the same dressing room area, but you don't want them touching. An additional common question that we're getting is about the public mask requirements. So what we're hearing from people complaining about people not wearing masks in locations is that people will call us and say, in this particular location, the customers or the employees aren't wearing masks. So we want to let you know that the employees have to wear the masks, and so do the members of the public. We know that it's a little bit difficult getting into enforcement. So really the best practices for that are to give verbal announcements when people enter your establishment, letting them know that they're required to wear a mask, and then also providing signage. And I will go ahead and show you some of that signage that the Chamber has created. I know that some of you had requested a little bit stronger language on the mask signage. So I'll go ahead and show you that.
And Angel, while you're doing that, we did add to that folder a sign that says, do not enter without a mask,
Okay.
or without a face covering. So we did add some of the stricter signs that people asked for after last week's call.
Okay, and let me go ahead and, so this is your, this is the Google Drive, and I did notice that on the top that we had here is, it's not working. Okay, I'll circle back to that when we go to the next session, or when we go to the next slide. So another question that we're getting is the one-way aisles, and then also being able to social distance within the aisles. So one of the best practices is to really remind people in the aisles as they enter, just let them know that just a reminder, there's one-way aisle markings, and please follow those. So sometimes people aren't necessarily, the customers aren't necessarily noticing the one-way aisles. Another question that we've gotten over the past week is, if you have 6-foot aisles, is that enough to not wear a mask inside the store? We say, yes, you still have to wear a mask inside the store. Your customers still have to wear a mask, because if people are passing each other in that aisle, they're not able to maintain that 6-foot social distance. Another common question that we're getting is where to buy PPE. And the Energize Colorado Marketplace is up and running now, which I know the Chamber's been working hard on working with the state on that. And this is what it looks like. You can go to Get PPE and scroll down. There's a place for tax-exempt organizations such as nonprofits to purchase supplies, and then businesses to purchase supplies. So you can just follow that, and then they have all the hand sanitizer, gloves, and masks that you can purchase there. Another resource that we've had for a while is also the Boulder County Public Health COVID-19 Supply and Guidance resource. Again, we are not necessarily endorsing any of these vendors, but we do collect them and put them on this list. There's also some instructions on here how to place the face covering on which you want to have clean hands when you're doing that, so that you don't contaminate your mask when you're putting it on. And then it talks you through how to put it on, remove it, and then throw it away. Down at the bottom, we do have some resources on latex gloves here and where you can buy them, retail suppliers to buy gloves. I am not sure what's going on here. So those are two resources that are available to you to buy PPE. And I want to point out a few resource spotlights here. The curbside guidance has been in effect for a while now. Okay. And it's still the same. And I know many businesses feel comfortable just using the curbside delivery, and we're encouraging you to do that for as long as possible. Because it is one of the better ways of keeping social distancing. So on April 24th is when we adopted the curbside. And these guidelines are they've been pretty consistent throughout, but we're just encouraging you, and I'll point out on our website where they are, where this is located. Another resource that we would like to highlight is that CDPHE has how to conduct symptom screening information. And this is, I'll show you where this is located, but basically how to conduct your health screening. You can also allow your employees to do the health screening prior to arriving at work. So you can basically have them fill out a form, take their temperature at home, and do the symptom screening, and then make sure that they tell you if they have any cough, any shortness of breath, chills, muscle aches, sore throat, loss of taste. And really what we're looking for the temperature is 100.4. And that's the mark where people wouldn't be able to come into work, and that you would have them go to the CDPHE website to report their symptoms. Another document that I would like to point out, I mentioned on the previous slide, is the clothing and soft retail products, the cleaning and quarantining. This is important because there's a lot of unfounded research out there, and I know that in time of crisis there are there's a lot of people trying to sell you goods, and we've heard questions about steaming clothing as a proper way to sanitize it, or using UV racks or UV cleaning devices to be able to sanitize products. We discourage you from using those. Those may be effective at killing the virus, but at the same time, they really are difficult to implement, and then they are costly. So really what is best is just doing a 7-day quarantine for those retail items. Just keep in mind on this sheet, we have listed the differences in hard surfaces, which the virus has been shown to stay on hard surfaces for 72 hours, and soft surfaces 48 hours. This science is constantly evolving as we do more and more studies, but this is what we have most current information provided for you. So I know that this was one of the questions that we were getting quite a bit in the beginning, because people like to try on clothing, and people want to be able to, the businesses want to be able to know how to clean those products. So another thing that we would like to bring up today is talking about outbreaks. So an outbreak is when you have 2 or more confirmed or suspected cases of COVID in your workplace. And we have procedures basically helping you. So if you go to the CDPHE COVID-19 outbreak report form, which that's actually a Boulder County form, we will help you, or you can also contact COVIDbiz at bouldercounty.org. This is a CDPHE guidance on what to do in an outbreak. So we want you to be able to go to the Boulder County website and tell us when you have 2 confirmed or suspected cases in your establishment, so that we can contact our epidemiologists and we can let them know. And we can work with you to set up a plan on how to get, how to make sure that the rest of your employees are healthy and safe, and protect everybody to respond to that. And our epidemiologists, they will basically work with you to do some contact tracing and talk about who has been potentially exposed to this. And we'll help you determine what actions need to be taken. So this is the Boulder County website, and we just have boco.org/COVID-19 business. We have a bunch of different resources on this page, and this retail section, this checklist, I know I went over in the first and second sessions that we've had for this, but I want to point out some other ones that may be applicable to you. There may be office-based businesses that are applicable to you, or personal services if you're kind of a cross between different retail and personal services. Additionally, here on the website, there's going to be ADA guidance for employee health information. This is really important if you do have those cases that pop up among your employees. And here's that link that I talked about with cleaning and quarantine retail products. And then the link for guidance on outbreaks in your establishment. And then also the PPE guidance. So there's lots of different resources here. One thing that I've brought up in previous sessions, and we don't necessarily have to go over at this point, is the sample face covering script. So that really helps you go through the scenario of how to talk to your customers when they're not wearing masks coming into your establishment. And I know that we've had some questions about the social distancing space calculator. There was one particular question that we had where somebody tried to download it and it got corrupted. Try to download the Excel file again to see if it works at that point. So I'm not sure what that glitch was at the time. But just in general, all of the past sessions that we've talked about for retail are available on this business sessions by industry group. So this boco.org/COVID-19 business, that's where we're going to have all of these lists and a lot of the resources that I pointed out. So again, here's that list or that website that I was talking about. Also, COVID-19.colorado.gov, that's the CDPHE website that gives you guidance, and that will be updated as the governor makes announcements or changes to the Safer at Home order. So definitely go here first. We don't know of any changes, or we haven't heard of any specific retail changes that might be happening on the 25th. But if there are any changes to that, it would be on the CDPHE website. Additionally, different cities, they have mask guidance. So if you have questions on what your city mask guidance is, please reach out and we will help you understand that. We're continuing to do these weekly sessions, and retail will be at 2 p.m. If you are like a convenience store or something along those lines, the food service session is really the retail food services is where you will need to be. We also have Spanish sessions that are going to be every Wednesday at 6 p.m. and those are all recorded as well. And so I know now, Corinne, you're going to be doing some polling, so I'll turn it over to you.
So yes, thank you, Angel. What I'm going to do is I'm going to ask our audience some questions as well, so you guys can get some feedback from them, as well as ask you some of the questions that have come in. So I'm going to start by launching our first poll. And I think this is probably one of the webinars where these poll questions are the most relevant, because it's about face coverings and social distancing. So the first poll question is that in the last 24 hours, what % of customers do you estimate wore a face covering while coming into your business? So I'll launch that. And while we do that, I'm going to ask you, Angel. Someone said that they're using a combination of water and bleach for cleaning, 3 parts water, 1 part bleach. Can they add an essential oil to help mask the bleach odor, like a lavender or peppermint?
Yes, because I mean, I'm not an expert in essential oils, but it seems that the requirement to clean is really that bleach water combination. So I don't personally see that there would be an issue with that.
Okay. So on this mask covering, this mask covering piece, I know we've gotten a lot of questions about, about the effect, about people wearing them, not wearing them, the fear that it's going to cause people not to want to come in. So what's the best practice that a retailer can do to ensure to their customers and to their employees that they're creating a safe environment?
So it is your right to post the signs that the chamber has created to say don't enter without a mask. I do think that we don't want you necessarily enforcing that and there being a conflict where you're really confronting and there's a situation that's getting out of control with maybe a belligerent customer. We don't want that to happen. If you do get in that sort of situation where somebody really does not want to put on the mask, you can call authorities so that they can be that enforcement arm for the mask order. I think that just in general, explaining to them that, you know, really people who are in this business, people who come into our establishment, they are deciding if they're going to return based on if they feel safe or not. And with you not wearing a mask in this establishment, it's not making the other customers feel safe and it's not making my employees feel safe. So I think explaining that to people and taking more of an inquisitive role might de-escalate the situation. But signage and verbal announcements, I think, are probably two of the best ways of informing people what your expectations are.
And one of the things is that the mask requirement goes beyond just the store's requirement. It is the requirement of the county. It is the requirement of the state for certain pieces of these masks.
And also, I would highlight that you saw the graph that Zach had shown before about how our cases are going down even after we've switched to the safer at home. Just the reason why they're going down is because people are social distancing and wearing masks, right? So really with that trend, that downward trend, that's really what we're gonna need in order to be open and stay open. So really just taking that inquisitive approach and explaining to people that, you know, with public health in mind, we need to balance the livelihoods of people and also the public health interests.
Okay. And each of those signs, and I'll bring those up, each of those signs say for our health and our economy. And they, if you go around Boulder County, you're going to see them all over a bunch of stores and businesses, not just retail. The next question, speaking of social distancing, the next question that we're going to launch is a question about how would you rate customer behavior at maintaining at least 6 foot distance from other customers and staff? And while people are doing that, Zach, we do have a question about the data. They see a discrepancy between the state and the county data, and in the fact that the county data shows a lower number than the state. And this particular person's concerned that this might affect county regulations and create a false sense of security to local residents and other businesses.
Yeah, good question. I can't answer as to the discrepancy of the data. That's not something I know. But to the false sense of security, I think that's a really good point. And it doesn't matter what the data is. The troubling thing, like the confusing thing about COVID versus, other threats or situations or things in life is like, as our usual problems that we're dealing with, we solve them and we move past, certain stages, right? Whereas, and then like we can go back and do different things, as we were doing them before, because it's done, it's over with, it's not an issue. With COVID, it can come back at any time. And so, there is no, I think the person asking the question raises a really good point that, like, in a way, any sense of security is a false sense of security. If the data continues to reflect that we're, cases are going down, that's something to celebrate. But it does not mean, a cause to relax what we're doing. It just means that what we're doing is working and we need to keep doing it. Because if we relax what we're doing, the face covering, the social distancing, the other protocols, then it's just going to go right back up again. There's nothing that would prevent it from going right back up again. So, what the data shows us is that, what we're doing is working. What it doesn't tell us is that it's working so we can stop doing it. It shows us that it's working so we have to keep doing it, just as we are.
All right, so Angel, this brings to a question about the Safer at Home checklist. And I think it's going to lead to a larger question that I'm going to ask Zach to explain. But is the Safer at Home checklist the final version?
Explain, can you clarify on the final version?
I think this is the thing. So right now you have posted the checklist based on the current order, safer at home order from the state of Colorado. I'm gonna take this question and put it aside second and say I've received emails from retailers all over the metro area that are like, safer at home ends on Tuesday. So can you explain the next stage, when the checklist would be what would be edited, what you have currently up, and what may be to expect on Tuesday?
So I don't think that we're hearing anything at our level about changes to the retail sector. Safer at home will probably continue for the foreseeable future. We will update this checklist if there is additional guidance that CDPHE has for retailers. But we think that this is probably going to be the new normal for now. So keeping in mind that these are probably going to be requirements that you're going to need to stay open. As Zach had said, the virus is still just as deadly, and we don't foresee it just magically being resolved in the near future.
Yeah,
And
I
Zach,
agree with that.
May 26th, it's not going to be like we're going to go back to normal. They're most likely there's a good chance there's going to be an extension of the safer at home with some additional services allowed.
Correct. Yeah, and I think that's that's an important thing to keep in mind. Whenever we near any of these dates where one order is expiring, until you will know when it's clear that we don't need any restrictions anymore, and that'll be when we have a vaccine or effective treatment. Most likely, and that is going to be, by all estimates, another 6 to 12 months, and so we're going to continue to get better at limiting the spread of the disease as we understand what works, and we're going to continue to have evolutions of the safer at home restrictions, but until we have treatment or a vaccine. If we were to just all of a sudden cold turkey end all these restrictions, go back to life as it was at the start of the year, then we will, a couple weeks, case counts will come back and our hospitals will be overwhelmed, just like we faced, back in March before we put these protocols into place. So I think one of the challenging things about this is that because, the state, local public health agencies are trying to be as nimble as possible and react as quickly as possible, but we're limited by the incubation period of 14 days of the disease. Plus, you need, every time you make a change, you need a week of whatever change you've made to start happening out in the community, and then to see 3 weeks later after you make that change, 3 or 4 weeks later, okay, what is the impact? Like, was that okay? Are we still doing good? We're seeing an increase in cases. So there's that 3 to 4 week delay in getting the information on which we need to be able to make decisions. And then once we have that information, we want to act as quickly as possible because, people's livelihoods are at stake, businesses, jobs. It's very, very important that we don't delay, reopening economy and businesses, any more than is necessary. And so put those things together and you get what we're up against now, which is, we're coming up on, the expiration of the current stay-at-home order, and we don't yet have much information about what comes next. But it would be an error to assume that, nothing comes next, or, something not very similar to where we're at comes next. But we're just trying to make those decisions, as soon as we can with the information that we have available, which is, 3 to 4 weeks delay. And then once we know that information, then we want to be able to act on it and allow businesses to react. So that means that you all, and us too, honestly, don't have much lead time from when the data is available on which we can make a decision to when that decision goes into effect, because we want to then act as quickly as possible. So that's kind of the challenge to this, and why it can be confusing of like, well, I haven't heard anything, so I'm going to naturally assume that, it's back to normal. That's not going to be the case this time around, and it's not going to be the case, the next time around, the next iteration of the change to the order.
That's good insight, and thank you, because I think because these are targeted industry webinars, in retail was able to reopen in a capacity. There are certain businesses that still have not opened at all, and whether that's in-room dining, estheticians, certain businesses that still haven't been able to. So there are going to be additional phases. I'm going to launch the next poll right now, and this poll is about what's most stressful about wearing face coverings and social distancing. Check all that apply. This information is being given to Boulder County Public Health and their Board of Health as they make the decisions about future orders around those areas. So please answer that. I think another question that came up in previous weeks, and I think it's good to reiterate, is for this group is the special hours for at-risk populations or anybody that needs an additional or different time. Can you go over that again?
Yeah, so the CDPHE Safer at Home order does say that you have to have special hours for vulnerable populations. And who's considered to be vulnerable population is people over the age of 65, people with pre-existing conditions, people, pregnant women, people with compromised immune systems. And you do have to have those separated in-store hours to allow them to safely shop. And you'll notice that the food industry, the grocery store, they've been doing this much longer than what regular retailers have, but they post maybe Tuesday and Wednesdays from 7 to 8 a.m. or that first hour right after they right after they open up. They allow people to come in and do their shopping to where it's fewer people and it's just people with compromised immune systems or more susceptible to catching this virus or being vulnerable to the virus.
Okay.
Something else I'd like to add on a related note is, we're getting a lot of concerns from the public about overcrowding at some retailers. Typically tends to be the larger retailers. But if anybody has, any questions about, what is the right capacity limit for my store, we are very happy to sit down with you and work through that calculation. We do have the calculator up on our website, but that is a maximum amount, and based on the conditions of your store, probably does not reflect the reality of what would be necessary in order to ensure that customers are able to maintain 6-foot distancing. And the reason that we can't make that single calculator input two figures work for everybody is the configuration and layout is different, right? And so we're more than happy to sit down with you and look through your layout and what would really be accurate and appropriate for your space, because the last thing that we want is to have an outbreak occur in your store. Bad for health, real risk to people's lives, also a big headache for you. And so that little bit of upfront work together with us could really save you some time and serious consequences for public health down the road.
Thank you.
And last week we did talk a little bit more about the specifics of like garden centers and like space calculators. So if you do have separate areas of your facility that you're having a hard time, perhaps rewatching that lesson or that work session might be a little bit helpful.
Okay. So I'm going to launch the last poll, and the last poll is about what resources you need would be most helpful to your business at this time. Please again check all that apply. So you can check more than one. And are there any more questions while we're waiting for our polling answers? Are there any more questions of Angel, Zach, and the hidden? We have another person on just in case we had some additional questions about those. So because retailers rely a little bit on the surrounding businesses around them, Zach, could you give a little update on what's happening with restaurants? Because that does drive some traffic to retailers, where they are right now.
Sure. They are anxiously awaiting the guidance from the state. By all indications, it looks like, Polis is moving toward making an announcement allowing restaurants to reopen for dine-in service with some restrictions. He's again waiting on that data to make that decision, but certainly taking steps to prepare for allowing that to happen. Now, again, in regards to the earlier comments about, after the 26th, it's not going to be, right back to it. I would anticipate that given the timing of the announcement, that there will probably be a couple days before it goes into effect, so that restaurants can take the steps necessary to prepare, because they will have to do quite a bit of work to do that. Also, I know that the Boulder Chamber, your chambers across the county, as well as your representative city staff, are pretty much all looking at doing some sort of outdoor dining arrangement that might involve closing down parking spaces or closing down streets. I would imagine that retailers would have opinions about that. And so, if you do, I would encourage you to contact your economic vitality staff at the city to have your voice heard. Because I know that those conversations are going on in most communities across the county. As restaurants have been, like everyone, have been severely impacted and are anxious to be able to begin, earning an income again, but also nervous about, what happens in the winter when they don't have the ability to do outdoor dining and we still have COVID.
And to be clear, because I think there was some confusion even on the restaurant call, unless you're in unincorporated areas of Boulder County, the decision on the streets, the sidewalks, the outdoors is the city's decision. And the items having to do with the actual safe operation of your business is the county that's following the state's orders. So there's, if people have opinions about the sidewalks and so forth, it's not the county that can really control that unless it's unincorporated.
Thanks, Corinne.
I get a lot of questions on that one, so I thought I would bring it up just to be clear. If you do know a restaurant that hasn't seen an email from one of us, they have until noon tomorrow, the 22nd of May, to give feedback to the state on the recommendations for restaurants. All right, so I'm going to end this poll. It looks like, again, it's employee training on use of PPE. One thing that I'm going to provide, thanks to Zach, in this email following today's webinar, and it goes to everybody that's attended this one or previous ones, is a video you can share with staff on how to use masks. Proper usage of masks, proper putting them on, some good information there. And then I know that we're working with some of the local chambers on some of the issues like improving your online presence and some local marketing efforts as we move forward. If we don't have any more questions, I'm going to thank Boulder County Public Health for providing these hours for you to ask your questions, to provide your feedback, and to really find out the best way to safely reopen for our economy and for our health. Again, these calls are every week. It's really your opportunity to get that updated information. There will be some new guidance next week, not necessarily in retail, but around what this next step looks like. So it might be a benefit to you to also attend next week, but we do record them. In the meantime, any questions, please follow up with one of those addresses you get. You'll get some more resources from me, and I hope you have a wonderful afternoon.